That satisfying burn during your workout quickly turns into tomorrow's struggle while going downstairs. Muscle soreness is so common that we have actually given it an acronym, DOMS, that is Delayed Onset Muscle Soreness. Although some of it may be good, too much of soreness may come in the way of your exercise and recovery and derail your workout routine. So, what can be done about it? Hi, my name is Dr. Sanesh Tuteja, and I'm a consultant arthroscopy and sports medicine at the Fortis Hospital Mumbai. First, let us understand what exactly is happening in delayed onset muscle soreness. When we exercise, especially when we introduce a new movement or we increase the intensity of our exercise, this causes micro tears in the muscles. This is not damage, but it is actually a muscle adaptation, and when this muscle heals, it becomes stronger. However, this healing happens as a result of an inflammation, and that is why this soreness kicks in about 1 to 3 days after the exercise. So, what can be done about it? Well, first and foremost, the recovery or the prevention of this can begin even before the workout is complete in the form of a gradual stretching. Once you have completed your workout, instead of abruptly stopping, focus on either doing some form of light walking, running, or even some active stretching, which would allow your body to gradually cool down and prevent pooling of blood in the muscles. Additionally, you can indulge in something called as active recovery, in which instead of your instinct to stay still, you could do some form of light exercise in the form of walking or light running or even swimming. What this would focus on is movement and would be beneficial in preventing stiffness in your muscles as well as enhancing recovery. Additionally, focus on nutrition in the form of giving your body proteins within 2 hours of a workout, and that would provide your body with the building blocks for your muscle recovery. Additionally, there are some foods like turmeric and omega-3 fatty acid rich fish that also naturally reduce inflammation, but bear in mind, do not rely on anti-inflammatory medications to cure your muscle soreness. Additionally, focus on hydration, as dehydration can itself delay the recovery process and it can prolong muscle soreness. Along with this, pause please. Additionally, sleep can actually enhance recovery, because sleep in when you are in deep sleep, your body actually releases the growth hormones and enhances protein synthesis. So ensure that you get about 7 to 9 hours of sleep after a heavy workout. Additionally, there are some form of therapies like heat and cold that can also be beneficial. Cold therapy can reduce soreness by reducing the inflammation by transiently reducing the blood flow to the muscles. Additionally, heat therapy can be used between 1 to 3 days post exercise. And how this works is it increases the blood flow to the muscles, and thereby it aids the muscle flush out the waste products as well as improve nutrition. Additionally, massages and foam rollers, especially when used gently, can enhance recovery and reduce muscle soreness. Progressive overload is the long-term solution. If you are experiencing muscle soreness frequently, then maybe you are progressing too quickly. Gradually increase the intensity, the duration, and the complexity of your exercise. Combining this with appropriate recovery techniques, you can minimize muscle soreness and maximize the gain from your workouts. Thank you.